Hello, I'm in Medical Terminology 3033, Section 53. Hello, my name is Ekene Okonkwo, and I'm a mental health practitioner. And I provide services for the purpose of improving people's mental health and treating mental disorders. The setting of the case study will be college women and men. I chose this setting because mental health is overlooked when it comes to college students. I would like to educate and give advice to these groups of people more on mental health so they know we care and are aware of their mental and overall health. There are many different types of mental health disorders, and the list can go on, but I would like to touch on the most common ones that we see in healthcare. The most common disorders I've seen in my healthcare settings are anxiety, bipolar, dementia, and PTSD disorders. Over the past year, I've seen it occur about 150 times in about 2,000 patients. The symptoms vary for each disorder, but they all share similar characteristics. For anxiety disorder, you most often see stress, restlessness, and the inability to set aside worry. Symptoms you see in bipolar disorders are high energy, loss of touch with reality, mood swings, and sadness. Symptoms you see in PTSD may include nightmares, unwanted memories of trauma, heightened reactions, and depressed moods. And lastly, symptoms you see in dementia look like mental decline, confusion, disorientation, and the inability to recognize certain things. Some treatments that are prescribed for patients that suffer from mental health disorders are antidepressants, anti-anxiety, antipsychotics, mood stabilizing, and stimulant medications. If the patient is against taking medication, I also advise meditating, yoga, or fitness to alleviate the stress. On average, the duration of the treatment lasts about 3 to 6 weeks, depending on the disorder/drug. Then we advise a follow-up appointment to see how the patient is doing. Then we evaluate if needed for more prescription. Some disorders like PTSD are a little different and are average 15 to 20 sessions for the patient to feel almost normal again. And what I mean by that is like they'll come in and we'll just like kind of have talk sessions for them. I had a patient who was experiencing anxiety disorder. She was 19 and an African-American college student. She had no pre-existing health issues, but was very nervous about how she was going to balance college all while having a job because she had to pay for school. I diagnosed her with anxiety disorder and prescribed her with anti-anxiety medication for 5 weeks. Around week 3, she was feeling better, and I recommended she kept taking the medicine until she ultimately felt better and the amount prescribed was done. Overall, the patient got better over time, and she is doing well with balancing school and her job. To conclude, mental health needs more awareness so that people can feel like they can open up about what they may be struggling with. Schools and workplaces need to bring knowledge about these situations so everyone knows how they can help one another. There are many ways we can all help prevent mental health issues. For starters, we need to value ourselves. We need to take care of our bodies. We need to surround ourselves with good people. We need to set realistic goals, find ways to deal with stress, and most importantly, get help when needed, ASAP. An important thing to convey to other health professionals that may be dealing with patients as such is to be patient and understanding of the patient, listen, and proceed with care. Major issues that still need to be solved with mental health care today are lack of support, lack of funding, social and economic disadvantage and deprivation, abuse, and many other things. And that's what we're all here for, and we will come together and do our part and save the day. Bye.